Do you want to know more about how you can eat for better health and longevity, and how your diet and lifestyle can play a part in chronic disease? Then you're in the right place. I'm Claire Day.
And I'm Daisy Lund, and we are both plant-based doctors with a passion for improving nutritional education. In this podcast, we will bring you all the latest medical evidence on how a plant-based diet can improve your health whilst being kinder to the planet and fairer to the animals that we share it with.
Twice a month, we bring you interviews from experts in the field with a focus on an important topic related to plant-based health, all while sharing recipes and food ideas.
So, welcome to In a Nutshell, the Plant-Based Health Professionals podcast. Hello everyone, and welcome to another episode. Hi Claire, how are you?
I'm good, thanks Daisy. A bit achy because I was practicing what we've been preaching and I went to do circuits in the park yesterday, and it's normally led by a retired PE teacher, but I had to do the leading this week because he had COVID. And I think I overcompensated for the fact that I thought I probably like exercise, that kind of exercise anyway, less than other people. So I was really pushing us, and I can feel it today.
Oh, wow. So achy in a good way, though.
Is it always in a good way? Yeah, I mean, I believe it will wear off. Yeah.
And can you believe we're at episode 10 already?
I haven't actually worked out how many episodes are in a series before we need to change the series sequence. Yeah, but we're episode 10, season 1. And I'm still feeling like there's quite a lot of work to be done, because we do really need to keep talking about food and health at work, because only this week I had a chat with one of my NHS colleagues who informed me that she'd switched her family from beef mince to pork or lamb mince. She hadn't used any of the veggie minces or anything, but she was going down the road of pork or lamb. And I must have looked so horrified because she said, oh no, is that a myth? And then we laughed because I said a myth is probably something that's widely held to be true. And I hope that wasn't.
What do you mean, like a myth in terms of pork or lamb being healthier? Because, I mean, I've not heard that one before. I've heard a lot of people switching from eating cows to eating other animals because they've heard that beef is worse for the environment. But what did she mean?
Well, of course, I went in to try and clarify that. And I said, better maybe in terms of the environment, maybe a bit better. But actually, no, she wasn't thinking about that. She was thinking about how to help her children to be healthier.
Oh, right. Okay. So for health purposes, well, we definitely have got a lot of work to do then, haven't we, Claire?
We have. Anyway, speaking of food swaps, we talked to today's guest about them, didn't we? And hopefully she's given us some better ideas.
Yes, indeed. We had a really enjoyable conversation with the Plant-Based Health Professionals Education Lead this week, registered dietitian Claire Lynch. And the focus of the episode was diabetes and diet. And when we say diabetes, obviously there are lots of different types of diabetes, more than just the two that my generation were taught about. But today we're talking about type 2 diabetes rather than type 1 or 1.5. And type 2 diabetes, as most of us know, is a result of insulin resistance, when the body is unable to respond to the effects of insulin, compared with, say, type 1, which is an autoimmune condition in which the body is unable to make enough insulin. So there is a lot of evidence supporting the fact that plant-based diets can both prevent and be used in the treatment of type 2 diabetes, and healthy plant-based diets can improve blood sugar control, and over time it can reduce the marker of diabetic control. We commonly monitor the HbA1c, and even in some cases can put type 2 diabetes into remission. But Claire, why do we go on about diabetes? Why is it so important?
The most up-to-date information probably comes from Diabetes UK, the charity, who've identified that more than 4.3 million people in the UK live with diabetes, but they estimate the figures might be as high as 5 million because there's a lot of yet undiagnosed diabetes in the population. Now, type 2 diabetes can be a very chronic condition for most people. It can cause complications that affect practically every part of the body, from increasing the risk of cardiovascular disease, so that includes heart attacks and strokes, to kidney disease, eye disease, and foot problems. And all of this comes with a huge cost to the NHS. It's currently estimated that at least 10 billion a year, that's around 10% of the NHS budget, goes on diabetes care, and that's projected to reach close to 17 billion by 2035. The only way that figure is going to come down is if we do something about the number of people that are actually living with diabetes.
And we can't we? Because we know there's lots of risk factors for type 2 diabetes, but some of them are preventable. And we're looking at things like strong links with obesity, diet and lifestyle factors, lack of physical activity, as well as things like social deprivation. So obesity, one of them, is on the rise, and we'll be discussing this in an episode in the new year. But what I found interesting was ethnicity is a big factor for diabetes. So people of Asian, Chinese, Black African and Black Caribbean ethnicities have been found to be 2 to 4 times more likely to have diabetes compared to white populations. And interestingly, type 2 diabetes is also more likely to develop at lower weight thresholds for these groups. So we really need to be thinking about modifying these preventable risk factors such as body weight, waist circumference.
Absolutely. And prevention, it should be at the front of our minds, as again, it's the data from the Diabetes UK website that suggests there are 2.4 million people in the UK who have, I think, what we describe as pre-diabetes, which means that they're at risk of developing it. Now, while we're spending more time in primary care screening for pre-diabetes or people at risk of diabetes, it's important to know we don't routinely screen in people under the age of 40, do we? With the exception of pregnant women or women diagnosed with polycystic ovarian syndrome, which is also something that puts you at higher risk of developing diabetes. And yet we're now seeing more cases in people under the age of 40. So that's before they would have their NHS health check, or at least have the option of having that.
Yeah, and I don't think, and there are many practices that routinely call and recall people with polycystic ovarian syndrome, for example. That message I don't think is really quite out there yet, that really women with PCOS should have their HbA1c tested yearly, shouldn't they, Claire?
No, that's true. So on a more positive note, there are lots of case studies out there which show you people who've put their diabetes into remission or at least reduced the need for medication. I was having a look for some of these last night, and I really like the PCRM, that's the Physicians Committee for Responsible Medicine Resources, as well, of course, as our own resources at Plant-Based Health Professionals. Now, they've got some great case studies and some great fact sheets too.
Sorry, yes, I'll put those in the show notes. There are other websites like Forks Over Knives, which have good case studies too. I also do direct patients to the Diabetes UK website because I find their advice is largely aligned with eating a plant-based diet. So they suggest reducing red meat whilst eating more fruits and vegetables, as well as including whole grains, so the healthy high fibre carbohydrates. And we do go on to discuss this in more detail with Claire in this episode.
So let's listen now to Claire Lynch talking about her plant-based journey and sharing her diabetes knowledge. After starting out as a nurse and then raising her family, Claire undertook a career change and qualified as a dietitian. She has worked within the NHS as a community dietitian and a diabetes specialist dietitian. Claire is also a board-certified lifestyle medicine professional. Currently, as a freelance dietitian and our education lead at Plant-Based Health Professionals, Claire's focus and passion is to seek every opportunity to educate and empower the public and health professionals with the knowledge and skills needed to begin transforming lives, particularly through the power of a whole food plant-based diet. Welcome, Claire.
Thank you very much. Thank you for having me.
Yeah, welcome to the podcast, Claire. It's great to have you. But before we get started, can you tell listeners a bit about yourself and how you came to being plant-based, in particular, how you came to being a plant-based dietitian?
Yeah. So I was a vegetarian as a teenager, briefly. Actually, it was for a good 4 or 5 years, I think, but it didn't stick long term. And then I think I buried my head in the sand for many years, lived with a lot of cognitive dissonance. I kind of knew if I started watching videos about animal farming or anything like that, I would not want to eat meat. But, I stuck my head in the sand and carried on. And then when I went to uni to do my dietitian course, there was a couple of things really. I think there happened to be a handful of vegans on the course. So I sort of was around vegans for the first time in my life. And then obviously as I progressed through the course and I started meeting patients and I started realising most of these diseases that I was treating and, all these poor patients that I was talking to had diseases that were preventable. And I started looking into the research more in my own time as well as what was on the course. Unfortunately, there's very little about plant-based diets on the courses, the dietetic courses. But started looking into my own research and realised that, the benefits of plant-based diets for health. And I turned vegan then really for my own health, just from seeing the research that I saw about how powerful it is. And I think I was ready. I was probably ready to jump on that in any case. And so I became vegan about 2018. Then 2020, I qualified and started as a dietitian in the NHS. And I think I just found it increasingly hard that the more I got to know of my own research outside of, like I said, outside of my work, I was still sort of looking into my own research. I started doing the British Society of Lifestyle Medicine course. I was looking at lifestyle medicine stuff as well. And I just realised that a lot of what we generically tell patients isn't based on best evidence a lot of the time. I just started to find it really difficult. I didn't feel like I was being true to myself a lot of the time in the advice I was giving. But it's very hard, particularly as a junior sort of band 5 dietitian, it's really hard to give sort of opposing advice to the rest of the team, if you know what I mean. I'm not very good at sticking my head above the parapet, really, especially when you're so new. So it's really difficult. The resources aren't really there in terms of written advice sheets that we give, in terms of the food that we give the patients on the wards. And I just found it more and more difficult. Just things like the generic nutrition support advice that's given. Everybody who's losing weight is just given generic advice about include cream and cheese and all this sort of stuff in your diet, regardless of who the patient was, whether it's a 97-year-old care home resident or whether it's maybe a 38-year-old bowel cancer patient. It's the same advice that's being given. And so I would, in my own time with patients, I would definitely start to put in some advice. If I was talking to the bowel cancer patient, for example, I definitely would sort of talk about more, sort of including more fibre and more plants and things. But the way we worked, I wouldn't necessarily have the same patient the next time. A different dietitian might have them. So again, like I said, it's difficult there then to give different advice.
Claire, so you really came to plant-based eating through your own research and your own health.
Yeah, definitely.
Okay, we know that you had this job as a specialist dietitian in diabetes, and we love to focus on a topic. So we're actually going to pounce on that and use that as a basis for this episode, and not least because of your particular knowledge in that area, but because we're seeing so many more cases of diabetes, and not just diabetes, but pre-diabetes. A lot of people are going to the doctors and finding that they're there to discuss that they've just had pre-diabetes come up on their blood test. So we thought it would be good for listeners to find out a bit more about what diabetes is and why it is a problem for health. Can you give us an outline of that?
So diabetes, it's diagnosed, your blood sugar's too high, too much sugar in your blood, and that's sort of a long-term thing, so then it'll be diagnosed. But obviously, how do we get to that stage is the main point, isn't it? And I think this is where patients aren't really often told. Many times when I've got a newly diagnosed diabetes patient, they haven't been told what diabetes is. They don't understand how they've got there. They often assume it's just genetic because they've got family members that are diabetic and all that sort of thing. So I'll go through how we get to the stage why we have too much sugar in our blood. So, ideally when we're eating, we should store carbohydrates and fats. So that's sort of our sugars and fats that we should be storing those in what we call glycogen in our muscles. So that's how you store your carbohydrates, and as fat under our skin. But if you have too much fat and too much carbohydrates, then that can start to be inappropriately stored. So it can be stored as fat inside your abdominal cavity and inside your liver and your muscle and your pancreatic cells. And it's this sort of inappropriate storage of the fat around the middle. So that's why we sort of often look at waist measurements with people, because it's when fat's stored around the middle that it becomes dangerous and a problem. And the reason that's a problem is this fat stored inside our liver and our muscle and our pancreatic cells causes inflammation, and it causes damage to the cells, to the organs. And so they become what we call insulin resistant. Now, insulin is the hormone that normally it should help the glucose that move from the blood. So that's the sugar from our food. It moves from the blood into the cells, into the organs where we need it for energy. But that starts to build up in the blood because, the insulin's not working properly. We're resistant to this insulin, and it starts to build up in the blood. And so those blood sugar levels rise. It's kind of stuck in the blood there. And then obviously when that becomes something that's happening regularly over time, that's when you're getting those consistently high blood sugar levels, and we're tipped over into diabetes. So really, it's about the sort of fat that builds up around the middle there from the excess calories and the excess fat that we're eating that's sort of causing the insulin resistance, that causes the diabetes, the high blood sugar.
And apart from somebody maybe noticing that they're carrying too much weight around the middle, why else, might a patient or a person think that they're suffering from diabetes? What symptoms might they have?
Well, they might be tired. They might be lacking in energy because, as I've said, like if the glucose, which is used as energy, is stuck in the blood, it's not getting into the organs, it's not getting into your muscles where you need it, it's not getting into your brain where you need it for energy, then it makes you feel very tired all the time. So that's a classic symptom, is being tired all the time. The other two really common symptoms are sort of being thirsty and weeing a lot. And they're obviously closely related. So you're weeing more because you're trying to get rid of the glucose out of the blood. Your body's trying to get rid of it because it doesn't want to have high blood glucose levels. And then obviously because you're weeing a lot, that means you're thirsty if you don't increase the amount that you're drinking as well. And also related to the sort of weeing a lot, you do tend to find that people can get more things like fungal infections like thrush and things as well.
Right. And those are the kind of short-term symptoms, aren't they? But when you're obviously seeing somebody as a dietitian and maybe they haven't got those symptoms and they're feeling not too bad with it, what are the long-term symptoms or health problems that people might get?
Yeah. So the long-term problems with diabetes are all really to do with vascular health. So the high blood sugar levels in your blood cause damage to your blood vessels. So you get the damage with the tiny little blood vessels that cause things like eye problems. So you can have cataracts and glaucoma and problems with your eyes because the tiny little vessels that go to your eyes are being damaged by the high blood glucose and also by high blood pressure, which you're much more at risk of when you've got diabetes as well. And again, in your kidneys, the same thing. Your kidneys can be damaged by being overworked, trying to get rid of all that blood glucose, and by the high blood pressure as well. And then there's sort of more the macrovascular, we call more the big blood vessels that cause problems like the high blood pressure. Like I said, it damages the inside of your blood vessels and it starts to cause what we call atherosclerosis. So that's where you get a build-up of fatty deposits on the inside of blood vessels, and that narrows your blood vessels. And the blood that's got a lot of blood sugar in as well can be more sort of viscous in it. So again, all those sort of narrowing of the blood vessels, this viscous blood means your blood pressure gets increased. And so that causes you to have an increased risk of things like heart disease, of stroke, of cognitive impairment, and then your extremities as well. So you hear of people having feet checked when they have diabetes, and that's because your peripheral arteries, so the arteries that go to the extremities of your body, can get damaged as well. And then you can get what we call neuropathy, which is when your nerves to your fingers and toes are not functioning as well. So you can't feel if you have a injury to your foot, for example. And because of your sugary blood, you're more likely to get infections. So if you get infections in your feet or anything, then that can lead to, we hear about people having amputations, toe amputations, foot amputations, and that's the sort of extreme end of the damage that can happen from diabetes.
Absolutely. And we've spoken on another episode about studies that have come out that have shown a link between eating a lot of meat and your risk of getting diabetes. And obviously meat contains a lot of saturated fat. And we were interested in the mechanisms behind insulin resistance. Can you say a bit more about insulin resistance and how it's a problem that is often driven by saturated fat, particularly what's found in dairy and meat?
Yeah, definitely. Yeah. I mean, there's actually been studies that have found that saturated fat is directly toxic to pancreatic beta cells, and they're the cells that produce the insulin that I was talking about earlier. Whereas unsaturated fats that we find in plant foods, like sort of olives and avocados and things, they're protective and they actually promote insulin secretion and, reduce insulin resistance. So, saturated fat can have a direct effect on these beta cells. But obviously also saturated fat is contributing to this weight gain. It's more likely to get stored in the liver. Increases the blood triglyceride levels, and that gets sort of pushed into the liver. And we know that actually the saturated fat encourages the fat to be stored within the cells that I was talking about earlier, actually encourages that incorrect storage of the fats. There's a lot of other things in red meat. So obviously it's just that this meat in itself is high in fat. So it's a high fat food. So, it's a high calorie food because of the calories in fats. There's sort of 9 calories per gram in fats, whereas there's only sort of 4 calories per gram in carbohydrate foods, for example. So when you've got a food that's high in fat, then that's going to, that's giving you more weight gain, isn't it? And we know that obviously a large part of developing diabetes is that weight gain as well. But there are other things in meat that also cause insulin resistance. There's a few different things. There's heme iron, which is the iron that's found purely in animal foods. It's a different form of iron that we find in plant foods. And we know that in itself causes insulin resistance and what we call oxidative stress. It's sort of a toxic effect inside the cells, and heme iron causes that. And also cooking meat at a high heat, and particularly a dry heat. So if you're putting meat on a barbecue or on a grill or something like that, that produces something that we call ages. And they, again, are toxic. So they cause insulin resistance as well. You get more like branch-chain amino acids from meat as well, and they also have been found to cause insulin resistance as well.
Thanks, Claire. You've given us a really good summary of how saturated fat, particularly from meat and dairy, can lead to insulin resistance. But what about carbs? Because I know they're quite often vilified, aren't they, for people who perhaps are worried about pre-diabetes or developing diabetes, or people with diabetes, in fact.
Okay, so unfortunately, in the UK, we are still, the NHS and sort of generally in the medical profession are still intent on pushing a low carbohydrate diet for treatment of diabetes. And I mean, there's a few problems with that. The fundamental problem, as far as I'm concerned, is that most plant foods are high in carbohydrates. So, if you're going to be trying to have a really low carbohydrate diet, you're probably going to end up cutting out an awful lot of those foods that we know are really healthful and full of healthful nutrients. And so, you can end up with nutritional deficiencies, like you can be deficient in folate, in vitamin C, in vitamin K, magnesium. Fibre is the big one. Everyone worries about protein, but fibre is the big one. Fibre is the main nutrient that we are, as a nation, very, very deficient in. And obviously, if you're on a low carbohydrate diet, what you're replacing it is. So as a dietitian, my first thing always is instead of what. So if you're going to cut out carbs, what you're having then instead. And most people will replace that with high protein foods. So like you said, sort of meat, eggs, or high fat foods. So lots of oils and butters and things like that. So again, I've already explained some of the problems with meat. And in terms of the high fat foods, then that's just going to cause excess weight gain. It's often going to go around the middle and increase that insulin resistance. So the thing is, when anyone goes on any restrictive diet, then they can end up having good results. So people do go on a low carb diet, and it might be that they are cutting out some of those other carbohydrates, things like the donuts and the what we would call refined carbohydrates. So all the sort of white flours and the donuts and the biscuits and the confectionery sweets and things, chocolates. And so they're cutting out a lot of those foods because they're part of the carbohydrate group. So that's good that they're cutting out those things. But obviously, as a result, and quite often they'll end up restricting in calories as well because they're on a restrictive diet. They're cutting things out of their diet. So they do end up under in calories as well. So they can get good short-term results from low carbohydrate diets. There's definitely some compelling data out there where people do get good results.
You mean good results in terms of weight loss, Claire?
Yeah, but also in terms of blood sugar control. Obviously, the other thing is carbohydrates are the foods that break down into glucose that ends up as the glucose in your blood that we were talking about. So if you're restricting the carbohydrates, you're naturally giving yourself less sugar in your blood because you're not eating those foods. So your blood sugar results can improve. But the problem is the long-term problems, in increasing fats, increasing meat and dairy, and all those problems that we've discussed, increased risk of heart disease, cardiovascular problems. If you're going to be eating a lot of meat-heavy diet, you're likely to have problems with your cholesterol levels and things like that as well down the line. And also the other thing is how sustainable these diets are. Can people keep this up long-term? Because there's no point really, is there? And even SACN, which is the Scientific Advisory Nutrition Committee, they produced an advisory on low carbohydrate diets because they knew that they were being recommended so often. So they looked into the research and they've sort of said they recommend that it's something that you can do short term, but not for longer than 6 months. So then what happens then? What happens at 6 months? So we need to find a diet that's sustainable for people in the long term.
And, there's two things that you've mentioned there that sort of really struck me is, firstly, when we talk about cutting carbs, and you mentioned things like the donuts and the biscuits and all the refined carbs, they're also quite high in fat as well. So people that are stopping eating them or reducing them, which is a good step, good first move to make, are actually reducing their fat intake anyway by doing that. So that they're getting the benefits of reducing their saturated fat and the insulin resistance anyway, and yet they're vilifying the carbs when it's actually the fats in those products that are really very high. And secondly, I always think that we can't paint the picture of carbs with, it's just too generalized. So a donut and a bowl of porridge oats, for example, are completely different foods, aren't they? And our body responds to them in completely different ways. And these healthful carbs, like you mentioned, these unprocessed or whole food carbs, is completely a world away from a donut.
Yeah, so I think we do need to define really what we mean by carbohydrates, and you're right, the whole food group carb gets demonized. We do very much need to distinguish between what we're talking about. So refined carbohydrates are, as you said, your sort of junky foods, your donuts and your biscuits, and some of you, if you have too much of the sort of shop bought white bread and things like that, those are what we would call refined carbs. So that they're basically things that there is some carbohydrate, there's some flour in them, but the flour's been stripped of all the outside of the husk of the flour grain, so all the nutrients and all the fiber's been taken away. So those foods are very low in fiber. They don't have all the plant nutrients that the whole foods have. Whereas what we would call unrefined carbohydrates, they're foods that they're near to their whole form. That's how they come out of the ground, sort of thing, as near to that as you can get. So they may have been processed a little bit, chopped, cooked, even canned, frozen, things like that. But they're sort of as close to the coming out of the ground as possible. And then, so when you're talking about the grains, sort of whole grains, rather than that grain that you make the white flour out of being stripped of that outer husk, you've got the whole grain that's maybe ground down or just squashed. If you're talking about like porridge oats or whatever, it might just be squashed and you might have your jumbo porridge oats. But that outer husk that's got all the fibre and it has many B vitamins and lots of other nutrients, that's all still present. And then obviously you've got your whole vegetables, you've got your nuts and seeds, and then your legumes, which is your chickpeas, beans, and lentils. And we know that legumes are really good at sort of stabilising blood glucose levels. There's been research done that's shown that they, if you have a meal with legumes in it, then your sort of post-meal glucose levels are much more stable. And even the following meal, after that meal, they stay more stable as well.
Yeah, that's brilliant. And hopefully that message is coming across that actually these are the sorts of foods we need to be eating more of, not just for sugar control, but for our gut microbiome and various other reasons. But what about fruit? Because I always find that's still a little bit controversial. People might be on either side of fruit.
Yeah. So again, there's a difference, I think, between fruit, whole fruit, and fruit juices that you might buy in the shop. And then you've got somewhere in the middle, you've got sort of maybe homemade smoothies. So fruit in itself, a piece of whole fruit is a perfect snack. Yeah, it's a nature snack, isn't it? And yes, it does have sugar in it. The sugar that we call fructose is in fruit, but it's wrapped up. Well, for one, there's not that much in there. You'd be surprised how little there is in there. And for two, it's wrapped up within all the fibre and within all the cells of the fruit itself. So it's not very accessible to your body. So when you're eating it, your body has to digest and get through all that fibre before it sort of accesses the sugar, if you like, in the middle of the fruit. And so it's released very slowly. You don't get that big spike of sugar just rushing into your blood after you've had it. It's released very slowly because it's got to digest all. And also along with that, you've also got other nutrients. So I haven't mentioned the word phytonutrients yet, which is what we call plant nutrients. Phyto's Latin for plant. So they're just nutrients that are only found in plant foods. And so some of those polyphenols is the name of one of them. They're all big long names, but these are also shown independently to help with blood glucose control as well and with insulin resistance. So this fruit that you're eating is, not only does the sugar not get released very quickly, but it's also got all those other nutrients which are helping the insulin and helping the blood glucose control as well. Whereas when you have some fruit juice that's, especially the shop bought fruit juice that you've, it's been stripped of all that fibre and all you've really got left is the water and the sugar from the middle of it. You've not got any of those plant nutrients there, or very few of them, and virtually no fibre there at all. Well, in fruit juice, I'd say you probably have no fibre at all. And so that does get they're digested really quickly. It takes no digestion at all. So basically, almost as soon as you're swallowing it, it's making its way into your blood, and that will spike your blood sugar. So, I mean, I wouldn't vilify having a small glass of fruit juice with a meal. Something like orange juice can be a good thing to take with a plant-based meal because it can help you absorb your iron, for example, from the plants. But we're talking a little 125ml glass. And definitely someone that has actively got diabetes, I would suggest if they're monitoring their blood glucose levels, that they sort of see how they react to it and take sort of decision from there. And then in the middle, we've got smoothies. So I'd say a homemade smoothie that's got maybe other ingredients in as well. It might have some greens in it. It might have some nuts in it and some seeds or something, flax seeds and a bit of fruit. Then that's somewhere in the middle, because you have still got all that fibre there. You have still got all those plant nutrients there. But because it's been whizzed up, all those cells that I was talking about and the fibre's all been broken apart. So the sugar has been released. It will spike your blood glucose more than a whole piece of fruit. And also it's the amount of fruit that's in there. Obviously, you're not going to eat more than 1 or maybe 2 apples at a time. But if you have a smoothie with fruit, you can get quite a few portions of fruit in just a glass of smoothie. So you've just got more sugar just in terms of because of the amount of fruit that's in there.
Yeah.
So I definitely don't want fruit. Whole fruit is a great snack. And even if you have diabetes, please eat your fruit.
Eat your fruit and don't necessarily drink your fruit. Great.
So we know that if you have been recently diagnosed with diabetes and you make some lifestyle changes, then it's relatively easier to reverse diabetes. But obviously, most of the people that we're seeing have had diabetes for years, and they often seem to be in a vicious cycle of health problems. They're carrying extra weight, and they'll literally describe feeling unwell when they don't eat something regularly to bring up their blood sugar, and that's how they'll describe it anyway. So how can we realistically motivate people to change their lifestyle? What are your thoughts on that?
I think for a start, we have to be honest with people, and we have to tell them. It's one of those things, isn't it, where if it's hard to say, you can do something about this with your lifestyle without making it sound like you're blaming them, like you've got a bad lifestyle, this is why you're. But I like to see it more as empowering people. A lot of people do really honestly believe that there's nothing they can do about the diabetes. And so I think if you start to empower people and help them to realise that actually there are things that they can do, that they can change, then that can empower them. And it's not a blame thing at all. We all live in the environment we live in. It's really very hard to eat a healthful diet in the environment we live in, unfortunately, with everything that's around us, especially in some places. It's hard to find a shop that sells good, healthful food at a good price, but it's helping people with practical advice, really. And it's helping them to realise that a lot of how they're feeling, that you described as sort of really needing those high sugar foods because they lack energy and things like that. So it's starting to explain things that I've just been talking about, like if you're eating those sort of foods, the processed, refined foods, then you do get the blood sugar spike after eating them, and then it drops again. And that's what makes them feel really low again, and they feel like they need that. And then you're just on this big roller coaster of blood glucose spikes and then drops. And when it can drop below baseline level, if you have something really sugary to eat, then it can drop below, baseline level. And so you can help them to realise if they start having more of these whole plant foods in their diet, then that stabilises all that sugar, and those highs and lows start to level out and disappear, and it starts to become more stable, and they don't feel those highs and lows that they describe. It's really hard to get rid of. So I think it's just being honest with people and helping them to understand how they can make changes. I think that one of the things I struggle with the NHS was it was very keen on moderate changes, and some people can only want to make moderate changes, then that's fine. But I like to be honest with my patients in terms of telling them the bigger the changes, the bigger the positive effects they're going to be. And then they can make that choice. I think too often we decide what our patients are going to be willing to do, and people see a plant-based diet as being a really drastic change. But when you think of the things that people are willing to do, people are willing to go on these really low-calorie diets, to have, liquid meals for 12 weeks, even to the extent of having gastric surgery. People do all sorts of fad diets, don't they? So I think we need to be more confident, really, in encouraging people to eat a plant-based diet and make them realise that it's not actually that much of a drastic diet. You don't have to be hungry. You no longer have to worry about portions sizes. You no longer have to calorie count. All these things. If you really go for it and you're really doing it sort of wholeheartedly, then all those things that you spent your whole life doing, which most of us have, haven't we?
Yeah.
You don't have to do that anymore, and it's not as drastic as it sounds.
And absolutely, and it's not a diet, is it? It's a lifestyle that is sustainable, like you mentioned earlier. It's a joyful lifestyle that actually is good for us, but also really easy to follow.
And I think that's the thing. I like to focus on sort of what you can add in and the joy of all the different plants that you can have, rather than, I think often the NHS advice is sort of, what you can't have. You can't have this, you can't have the other. And whereas I'll focus more on what you're bringing in rather than what you're having to take out as well. So, and swaps, I like to focus on swaps a lot of the time, easy swaps as well.
So can you give us a couple of examples of what sort of swaps you mean, Claire?
Yeah, so I think the first thing I like to do is talk to people about, most people only have a handful of meals that they make regularly. Let's be honest, most of us, we have the same few meals, don't we? We might occasionally go to a recipe book and have something else, but most families have the same few meals that they have on rotation. So I think I like to, obviously this is individual advice and you have to have time to do this. It's very hard for some people to have the time to do this, but I would find out what their favourite meals are, and then try and help them with plant-based versions of that. And sometimes I will literally start with going half and half. So, for example, a typical British thing might be like a ragu or bolognese. So that, if you think of a minced bolognese, you can make shepherd's pie with that, can't you? You can make lasagna with that. You can have spaghetti bolognese with that. People have those sort of meals quite a lot. So I might see how far people are willing to do, but you can swap out. I might say take half of the meat out and throw in a can of lentils instead. As half the meat, go half and half for a couple of times, and then maybe see if you can go the full way. Things like a bean burrito instead of a beef burrito. So it's kind of finding those meals and making getting them to experiment with plant-based versions of it. You can direct them to different sort of websites that have good recipes and things like that on there, good plant-based recipes, and get them to just play around and try and make it fun for them. Like, why don't you try a few different recipes and see which one your favourite is and which one you can make most easily, which one's the quickest to make, and things like that. So, and then there's just more direct swaps. So things like finding the swap for the favourite snack, for example. So maybe if the favourite snack's crisps, then can we have a handful of nuts instead, or can we make some popcorn with some spices on, or some roasted chickpeas with some paprika on, or something like that. So just some direct swaps like that. And again, I will always be encouraging a piece of whole fruit for a snack if people like a snack in the middle of the day. So, and then breakfast, I suppose, is a really easy one as well. Some people that might be having the sort of sugary cereals, seeing if we can go more down the route of whole oats. So whether it be, homemade granolas or a porridge or whatever, then just sort of swapping, making those swaps.
Excellent. But, coming back to when you've got that patient in front of you with lots of problems linked to maybe obesity, and you're having to tell them as well that they've got fatty liver. We usually describe it as the non-alcoholic fatty liver disease if they're not drinking. How does that come about from insulin resistance?
Yeah. So fatty liver is very closely associated with insulin resistance. I think something like 70 to 80% of obese and diabetic patients have non-alcoholic fatty liver disease. So it is very, very closely related. And I think, a lot of the time it is the fructose in those sort of refined foods that we talk about that can be a cause of fatty liver as well as the saturated fats in the meat that we talked about earlier. And they're very closely related, because fatty liver also, if you've got fatty liver, then you have got problems with insulin resistance as well. So
I think most people are going to be convinced by just the food we're talking about, and the kind of diet you can follow, and that it's actually really enjoyable. But what if you've got a tougher person who wants a bit more evidence? Are there any studies that we haven't mentioned yet that we could direct them to for supporting using plant-based eating to prevent and treat type 2 diabetes?
So, the main studies that are sort of a big, what we call prospective cohort studies. So they're when you follow a group of people from, for over, it's been decades, some of them, 2 or 3 decades they've been followed for. And generally when they start, they don't have any chronic diseases. So the the participants don't have any chronic diseases when they start following them. So there's things like the Adventist Health Study, the Epic Oxford Study, that have been following people throughout from the 80s until recent times. And then they just basically watch those people and see what diseases they get. They're regularly taking blood levels of things, blood pressures. They're asking them what they're eating over the years. And then they look back and they analyse all the data basically and see sort of who's getting these diseases. And from that, they can work out who's at biggest risk of things. And the Adventist Health 2 study has shown that those following a vegetarian or vegan diet have a 77% or a 54%. So it's the 77% is with the vegan and the 54% is with the vegetarian diet, reduced risk of developing diabetes compared to those that are eating the most meat in their diet. And you can see it, the progressive. So they divided these participants into omnivores and then people who are eating fish and then semi-vegetarians and then sort of vegetarians and vegans. So progressively removing meat from their diet. And you can see like it's a dose relationship sort of thing, that the less meat they're having, the reduced risk in a linear sort of relationship to that. So that's really encouraging. And similarly with the Epic Oxford, I think they found avoiding meat was about 50% reduced risk of diabetes compared to the regular meat eaters. And then another one actually is that's been really good recently is the people in America. There's a study group there. It's the Nurses Health Study and the Health Professional Follow-up Study. With a lot of these studies, there's often not a lot of vegan and vegetarians, so it's hard to get the numbers to study them. So what they've done is they've developed what we call a plant-based diet index, and then they're basically sort of scoring plant foods versus healthy plant foods, so your whole foods that we've been talking about, your fruits, vegetables, nuts, seeds, legumes, and the unhealthful plant foods, which is more the refined grains, and then your animal foods. And they score positively and negatively so that they can then analyse, the more plants and the less meat you have in your diet, what happens and what are your risks. So it's really good because this doesn't have to be people that are on 100% vegan diets. It can be, so this can be encouraging to people that aren't willing to go all the way. And you can show that just removing small amounts of meat can make quite a big difference. So yeah, the diet that emphasised plant foods and was low in animal foods was associated with a 20% reduction in the risk of diabetes in that study. And when they looked at the healthy plant foods rather than just plant foods as a whole, the consumption of the healthy plant foods was associated with 34% decrease in diabetes risk. And then they've taken it one step further and they've looked at changes in people's diets over the years rather than just looking at the baseline. They've looked at the changes and when people increase their plants in the diet or decrease their plants in the diet, what happens over subsequent years, over the next 4 years. And they found that every 10% increase in adherence to a healthy plant-based diet reduced the subsequent risk of diabetes by 7 to 9%. And then the reverse is true. So every 10% decrease in a plant-based diet resulted in a 12 to 23% higher risk of diabetes. So it just shows that even, just making small changes, so maybe, having 4 or 5 days a week where you're not having meat, it's really going to affect your risk of diabetes.
Yeah, I mean, it's great in some ways that it's a dose-related response, but I know what Alan Desmond would say, and he would say 100% plant-based for 100% benefit.
Yeah, which is what I was saying about being honest with people. Like, I think we have to be honest with people and say, look, if you want the most benefit, then you need to go all the way. But we are also working in the real world. And you as GPs are. I mean, now I'm a freelance dietitian. Obviously, people choose to come to me because they may have those sort of beliefs. But, as a GP working in the real world, not everybody's going to be willing to do that, are they?
Yeah.
So, yeah, I think we have to be realistic as well. I absolutely agree with Alan's sentiments, and I wish that, we could persuade everybody to do that. But
yeah, I was just going to say, sometimes you have to meet people where they are, don't you? And just work with them, and hopefully small changes lead to bigger ones.
Well, that's it as well. And I think people start to feel better and they start to realise these meals are actually tasty. And, maybe if they have got diabetes and they are having those swings of high blood glucose, low blood glucose, and that starts to flatten out and they start to feel better, then people can slowly. A lot of people who turn whole food plant-based don't do it overnight. A lot of people, it's a gradual process.
I agree.
Yeah, definitely. Because I think having a diet that's changing over time is the only way that we're going to sort of change habits in families. as we've discussed, there's some quite unrealistic diets out there that are just about focusing on someone's illness and expecting them to eat quite abnormally for a period of time. And that doesn't really teach other family members anything about how to avoid diabetes. So all of that is great to hear. It's been a really interesting discussion. But we can't let you go without asking you a very popular question with our listeners, which is what does a dietitian with such expertise in diabetes have for dinner on a Friday night?
Well, as it's already tea time, it's something that I can prepare fairly quickly. So tonight I'm having a deliciously Ella recipe actually off her app. I subscribe to her app and I do love it. So I'm having butter bean, apricot and tomato stew tonight.
Oh,
so that's quite easy. It's tinned butter beans, so quite quick and easy. Yeah, with some quinoa, I think.
Can you say something about the spices? Is it like my Moroccan tagine that I had,
yeah,
or is it going more curry?
No, the sweet spices. So like cinnamon, a bit of cumin, and a bit of paprika. I think mainly in there. I think there might be turmeric as well.
Nice. Yeah. Is it like a one pot type dish, Claire? You just bung it all in the oven?
Yeah, on the hob.
Yeah, on the hob. And that's the thing, isn't it? I just find plant-based eating is actually much more simple than what people expect it to be. It's quick and easy, isn't it, really?
Most of the time it really is, yeah. I mean, I listen to you and I know, Claire, you do things like make sourdough, don't you? And make seitan and stuff. And I have to say, I haven't managed that yet.
Yeah, but I get bored easily, Claire. So once I've done it once, it can give the impression that I'm always, conjuring these things up. But actually, once I get a bit bored, then I'm more likely to go for the shop bought seitan, and definitely sourdough. The shop bought one is often much better than mine.
So what are you conjuring up tonight, Claire?
I've got the night off. So I am going out to a local vegan cafe, which opens specially on Friday and Saturday nights, and they do tapas night. And I was in there earlier today, reading through my notes and had a coffee. And, I saw they were open and I thought, I'm going to give myself a night off, because I asked her what tapas she was doing, and she's doing obviously one of my favorites, hummus and some olives. And then she does sort of roast peppers and aubergine dishes and some amazing patatas bravas, and all served with lots of lovely breads and things. So that's where I'm going to be tonight.
Aubergines are one of my favourite. I love aubergines. Aubergines and mushrooms.
Last but not least, what's Daisy having?
I'm having aubergine tonight. I prepped it yesterday because I knew I'd be having a really busy day today. And like you say, Claire, we're recording right into tea time. So I made an aubergine and lentil curry last night or yesterday, which I will reheat today because curries are always nicer the next day. And it was the first time I made curry in the oven. It was a recipe on the Vegan Richer website. I don't know if you've come across that website. It's lots of Indian recipes. And it's, again, I was amazed at how quick and easy it was. So you have to chop up your aubergine, some red onions and garlic and ginger. And you just put all your spices, you've got to have a good, well-stocked spice cabinet, I'd say, for Vegan Richer recipes. Put all your spices in through that and let that roast for about half an hour. And then once you bring it out the oven, you add red lentils. You can add some stock or coconut milk or plant milk, whatever you choose. Put it back in the oven and some tomato sauce, so passata or something like that. And then half an hour later, you've got a really delicious curry, which I sampled last night, and I cannot wait to reheat and eat it with probably some brown rice tonight.
Daisy, is it in one of those sort of big terracotta lidded pots where you have to keep adjusting the shelves on your oven to fit it in?
Yeah, no, just a normal oven dish, to be honest, and some parchment paper or some foil over it, if you don't have a special pot. But yeah, no, really easy. And first time I made a curry in the oven, so I'd recommend it.
Great, very accessible. All right, so shall we finish there then, and we can go off and get our dinners on the go? I can get ready to head out, and and you haven't got any work to do with that one, have you, Daisy? It's already done,
all ready to go. So yeah, let's just say thank you again to Claire for coming on today. We've really enjoyed speaking with you, and we hope listeners have enjoyed listening to your advice about how to eat whole food, plant-based, for the prevention and the people with diabetes.
Thank you so much.